Hi, I'm Richard Phillips and I'm a Sydney-based journalist for the World Socialist Web Site. Today I'll be speaking with Dr. David Berger, a long-time remote emergency GP with years of hands-on medical experience working across Australia and elsewhere, and very active in all forms of media, educating, alerting, refuting false information about the pandemic. Joining me in this discussion today is Cheryl Crisp, National Secretary of the Socialist Equality Party, and we will discuss the pandemic and how we think it needs to be combated. Before we begin, Dr. Berger, could you tell us something about your medical background?
Yeah, sure. So I qualified in medicine in London in 1991. And I think that's kind of relevant because I came from a medical tradition, the sort of post-war British medical tradition, which was actually, and as I look back on it now, I realize extremely idealistic. And I had very idealistic teachers in medical school with a feeling of a very direct connection to the sort of crusading doctors of the late 19th, early 20th century. I then started training in general internal medicine and just decided that I wanted the breadth more than the depth. So I went into GP training. During that time, I've worked in various places in the UK, also worked in the Solomon Islands and in Switzerland. And I was a rural GP in England with my wife, and we left the UK in 2012. Went to northern India for a year where we lived in the Himalayas, and we both volunteered. Our children were at school and we volunteered in a small community hospital, and then came to Australia. And since that time, working pretty much entirely in remote emergency medicine, mostly in Western Australia, but also across in Queensland and New South Wales.
So you're a member of the AusSage working group. That's right, isn't it?
Yeah, I guess peripherally. I mean, I contributed to their paper on remote health with reference to COVID. I'm not an active member of the group, but I did contribute to that.
That's what I did want to ask you about. What were the general recommendations that you made, and why were they necessary, and what was the government response?
Well, there's not really any response. I mean, there's never a response. I also wrote, I was the first author on a letter that you may have seen that we wrote in February 2021, a letter which was signed by about 500 prominent academics and clinicians in Australia and overseas, calling for recognition of the airborne nature of transmission and the consequences of that in terms of suppressing transmission. And that also really received a response from the government. I mean, it was barely worth the name. So really, you don't tend to get a response, but these things always get looked at. Really, it was that paper was just arguing for a recognition of the needs of rural populations, in particular Aboriginal populations, with respect to particularly things such as ability to isolate, which can be which, as we're finding now in Northern Australia, is extremely difficult for a lot of Aboriginal people, just simply logistically. And also a need to combat a lot of the anti-vaccine propaganda that's been going around, that's been extremely prominent, extremely pernicious, some of it propagated by fundamentalist churches. So, I mean, the needs of rural communities are somewhat special in terms of transport, particularly here in Australia, transport, accessibility to healthcare. But in the end, we're all in the same boat wherever we live.
Can I just ask, Dr. Berger, I noticed that you said that you had discussed with other doctors. We have just posted an interview with a respiratory scientist who works in a major hospital in New South Wales.
Mm.
And he also raised that he got, and they got, virtually no information from, you know, when COVID first developed, that they got virtually no information from the hospital and none from the government. And he also, and they discussed with their colleagues in Australia and also internationally. Are doctors surprised that they have had to undertake that sort of collaboration rather than get information from hospitals
Yes.
and governments?
Yeah, definitely. I mean, this whole thing's been a surprise, and I think we've all learned a lot in the last 2 years, all of us in different ways. When the pandemic hit, as a non-specialist public health physician, I'm not a specialist infectious disease physician. It was very obvious when you looked at the Diamond Princess, the Ruby Princess, and then the case report that came out very early in March 2020 of the infection of the choir in Skagit, Washington, where they had a choir of about 110 people, I think. 2 infected individuals during a 2-hour choir practice managed to infect over 50 members of the choir. And it was very obvious from all of those things, and from the experience with SARS-1, which had already been established to be an aerosol-borne infection, that this was an airborne infection. And it was to say it was a surprise to see downgrading of PPE in the UK and Australia in February, March, April 2020, which it all started off as airborne and got downgraded to droplet protection, surgical masks, which are not really PPE anyway, was a huge surprise. And I wrote with Andrew Miller, I wrote a 5,000-word paper on this about the need to protect healthcare workers, which was submitted to various state health authorities in ministries in Australia and the federal government, and that received next to no response. And subsequently, what you're seeing now in Australia is that, yes, we now have largely accepted the need for airborne protection for healthcare workers. And that has been a huge struggle, a huge bad-tempered struggle. And I wrote in January 2021, I wrote an extremely bad-tempered editorial piece in the British Medical Journal called Up the Line to Death, about how governments were betraying healthcare workers. And the recalcitrance, I have to say, we doctors as a profession are not coming out of this as the good guys. There has been extreme resistance to the notion that this is an airborne disease, with the implications that has for protection of healthcare workers, patients, and the general population. And that has come from entrenched interests within the medical profession. I mean, if you were going to say to me that, here's this conspiracy theory that, doctors are going to care if a disease is transmitted by droplets or aerosols, I would have said 3 years ago, you are completely insane. Who's got a vested interest in that? Turns out, we're kind of fighting big hand washing. I mean, it's the biggest, weirdest thing I've ever seen. And it's been a huge struggle, but now, Melbourne, the second wave of infections in Melbourne in August through October 2020, where we had 4,000 healthcare workers infected. That was a big wake-up call for Australia. I got in big trouble at the time for being so outspoken. But, it's, and I guess the surprise is that it's had to take so many of us arguing so strongly for the most basic protections. And that's in the healthcare realm. And then you look more broadly in society as a whole, and you go, you know, it isn't rocket science to suppress transmission. And I think that's the real crux at the moment. Battle lines have been drawn between the let it rippers and, you know, we must accept a toll of death, short and long-term disease and disruption to go back to, you know, normal, in inverted commas, as if we can go back to a 2019 normal. And on the other side, people who believe in the fundamental principles of public health, that diseases thought we must suppress transmission of disease. I mean, this goes back to John Snow and the Broad Street Pump in the 1850s, who was the man who first demonstrated that cholera was a transmissible disease. And of course, there was a huge struggle then, you know, and it took decades for this to be accepted. But over the next 50 years, 70 years, 100 years, this became accepted. We started to clean the water that we drink. We had indoor sanitation in Western countries, at least, and a recognition that, you know, drinking dirty water was a root cause of transmissible disease. And now it feels like deja vu. It feels like we're going through the same thing, that overcrowded, underventilated spaces are the cause of disease. You know, we've accepted for years that in winter, when you're crammed into stuffy rooms, everybody gets a cold. Well, now it isn't just a cold, it's COVID. And that's no longer acceptable. It shouldn't have been. And I think we've all been sleepwalking.
You had described it, the struggle, as an information war, and that, you know, all the rudimentary sort of requirements to fight this, generally speaking, are there.
Yes.
But it's gone from vaccines were going to be the silver bullet to Omicron is mild, children don't get infected. And now in the last, the last 3 months, the reopening of the schools and infection and levels and deaths on a scale way beyond what had happened in the previous 2 years.
That's right.
I mean, what are the conversations you're having with other doctors about this? There must be incredible concern and anger about the political forces you're fighting here.
Yeah, there is. You know, I speak to a lot of different doctors. I think, in a way, you know, doctors are just citizens. And yes, they have some special insights. They also have their own political views, tend to be conservative. They also have their own interests, financial interests. We're essentially, many of us are, essentially you can view us as sort of small business franchise owners. And they are, in their being, as parochial as any other group of citizens. So I think many doctors will accept the line that they're fed. Others look at the discrepancy between the what they're supposed to be being led to believe and the reality that they see on the ground. So I do think, I think there are many fine doctors. I do think, as I've said before, that as a profession, we have not covered ourselves in glory on this. And that we need to really wake up to some of the ideals of the 19th and early and mid 20th century in terms of combating disease. What's happening now is unprecedented. We have never in modern history rolled over and said, yes, we submit to this infectious disease. It's all too hard, wearing masks, cleaning the air, suppressing transmission. It's a big hassle. We're not going to do it. You know, I mean, polio only had serious consequences in less than 1 in 200 children. The vast majority, 75% of people who got polio, were asymptomatic. If there was a polio epidemic going around, it was much less visible than a COVID epidemic. And yet we've essentially eliminated polio from most of the world, and it's not far off eradication, which means it's not, it's not present at all. So, and the same goes with measles. Same goes with so many things. Cholera has essentially been eliminated from most of the world, not because of cholera vaccines, but because of better hygiene measures, hand washing, better water, high quality water. So what's happening now is absolutely unprecedented. And when you look at the known risks in terms of death, acute disease, and longer term disease, and the unknown longer term risks of an illness that replicates in pretty much all of the body tissues, if you keep grounding yourself in that reality, you just have to pinch yourself, because you go, well, what's happening is crazy. I mean, I often use the example of chickenpox and shingles. So the relationship between those two conditions was not established until the 1950s, when they had electron microscopes. They could actually see the virus. But if you said, look, here's a virus, here's a rash, childhood rash virus, causes a bit of a febrile illness, you get a rash, kid's a bit niggly for a week or two, mostly they're fine. A very few get really sick, but mostly they're fine. And then you said, oh, but by the way, this virus then retreats, goes to live in the anterior horn cells of the spinal cord, and can reemerge 6, 7, 8, 9 decades later to cause a completely different illness called shingles that can have extremely severe and debilitating neurological and ophthalmological effects. You go, well, that's crazy. I mean, it's just crazy. You couldn't make it up. And yet, that's something that we accept as reality. So we are now infecting ourselves, and more critically, our children, repeatedly with this virus that is rapidly mutating and changing its form, with no firm knowledge of the long-term consequences, which we can't have because we haven't had it for the long term. And if you look simply in a risk management framework, that's insane. The risk that we're exposing ourselves to is insane. And when we're doing it to the children, we better watch out, because it's the children of today who write the history books of tomorrow. And they might be pretty pissed off with us. So, they'll be choosing our nursing homes. So we better stay on their sweet side. But, so I feel, personally, I just feel really at sea, because so much of what I thought, I mean, I've always been fairly circumspective and a bit cynical maybe, but realistic. But now it just seems that anything's possible, and that we can convince ourselves of the craziest things, that humans should be farmed like battery chickens, rather than that we should, as doctors, take account of the humanity of all of us. And in talking about this, I think particularly of anybody with a clinical vulnerability, anybody with diabetes who's immunosuppressed on monoclonal antibodies or treatment for rheumatoid arthritis, or who's on steroids, or who has any other intercurrent morbidity, any other underlying illness. What we're effectively saying is, well, we've done our bit, we protected you for 2 years, but it's just too much hassle now. We'll get on with it. The young and the fit, the vaccinated young and fit will probably be okay. Losses in that group, injury in that group will be acceptable. Rest of you, do what you like, survive if you can. And that's a pretty harsh position that we've adopted really without a thought, and that everybody's taken on. I mean, it's old style, early 20th century eugenics. It's ableism. It says those other people, the more frail people, the more vulnerable people, the people who do not fit to a certain ideal of physical perfection, tough luck.
The World Socialist Web Site, right from the beginning of the pandemic, we analysed that, in fact, one of the underlying driving reason for the measures, certainly that were most sharply seen with Johnson in Britain, Sweden, and now really every government is bound up with the fact that no government will any longer allow the priority of health over production. And
Correct.
one of the reasons, and in that sense, Perrottet, Dominic Perrottet, the New South Wales Premier here, just said it outright. We have to open the schools on day one and not close them again, because that's what the economy needs.
Yes.
And so the driving back of children into schools, who, as you say, now mean that increasingly so many children, I mean, I've described it before, that the schools are no longer really educational institutions. They're just infection hubs.
Correct.
Everybody who is getting infected in one way or other, most of them are from their children who are at school. And of course, nobody knows what the effect of long COVID will be, but it is bound up with the prioritisation of profit, production over health. And I don't think, and as you say, that to a large degree has been accepted, but certainly in Australia and New Zealand, people followed the lockdowns. They followed the restrictions. I mean, China has followed, and the population agrees with zero COVID. But even in China, there is now a demand, particularly through the Financial Times and the major, international corporations, for them to discard it. Yes.
It's a weird situation on the face of it. As you say, it's not something I would ever have predicted. When you look at it in historical context, it becomes much more obvious why this has happened. We have this increasingly individualistic society, and we're now conflating the economy as society. The economy, which is actually, what is the economy? It's made up of individual people carrying out activities. But the economy is now the aim, the be all and end all. And actually, who in the end does it serve for individuals to promote the short-term activity of the economy at the expense of their own health? It doesn't serve them. It serves the people with the levers of power and the financial levers. And it's very bizarre, because I don't have a history as a kind of socialist activist. But if you look at, what's happening now, I mean, this is the 1880s, it's the 1860s, it's this kind of struggle out of which, bizarrely, Marx and Engels wrote Das Kapital and all this. It almost feels like, we're back at the tail end of the English Industrial Revolution, in the way that ordinary people are being exploited to deliver profits for Qantas or whomsoever.
Well, the billionaires have all doubled their wealth.
they're very happy for everybody to get back to work as they shelter in their villas and don't have to go into the office or stand on a crowded train or bus. So it's a really scary situation, and we've seen, and I have to say, I have been incredibly disillusioned to see scientists and medical professionals helping conflate these political decisions as helping to promote them as scientific ones. And often, like this whole thing about children's mental health and, oh, they've got to get back in school, etc. Well, the evidence is very clear. I mean, I'm not arguing against school per se. School per se, education per se is a good thing. I wish it would teach people to discern fact from fiction a bit better, but school for a lot of kids is actually pretty catastrophic.
Yeah.
And actually children's mental health has not suffered during, protections, lockdowns. And the evidence is that self-harm rates have gone down and suicide rates, etc. There's evidence from all over about that. So, these crocodile tears about think of the poor kiddywinks, get the children back into school, I don't buy that for 1 second. And how you can worry about children's mental health from being out of school, but not worry about children's mental health from contracting an infection, which infects their vulnerable parent or grandparent with serious consequences, I have no idea. And I don't know how you can do that and sleep at night, but people do. So the schools and the children have been weaponized as a means to get people back into work. And, you don't need a huge imagination, in my opinion, to see this agenda at work. And as, rather an idealistic doctor who thought that we were there to promote health in individuals and health in society, it's been a pretty dispiriting 2 years, I can tell you.
What sort of pressures have you come under to shut up? I mean, I know that there's a campaign to marginalise scientists and doctors who have spoken out. I mean, papers have written, editorials. I mean, Guy Marks and Brendan Crabb and Raina McIntyre issued this sort of article in January, how to eliminate COVID.
Yes.
And nobody reported on it. Basically, we published it in the WSWS, but nothing.
I know.
Mainstream.
I know. Yeah. There's no interest. I mean, in terms of the media, we don't have to go into the ins and outs of concentrating media ownership in a few right-wing moguls with very clear agendas, but we're seeing the consequences of that very, very clearly. We see supposedly independent media outlets, quasi-independent, such as the ABC, which are under so much funding pressure and so much pressure in so many ways that they cannot escape being essentially largely a client media, not completely, but largely a client media that is promoting a government line. And the window of discourse in the media is extremely narrow and has become extremely polarized. I mean, the idea that which I've been called a zero COVID zealot, a zero COVID extremist, and it's just bizarre, absolutely bizarre. And yet that stuff sticks. Here I am arguing for disease suppression and ultimately elimination, as we've done with every other infectious disease, or at least every other infectious disease that's affected white people, malaria and other things less so, but that has been the general direction of travel. And yet promoting individual health, resisting the notion that people should embrace illness as in this kind of cultish way, is now an extremist position. And in fact, after a full start, I've got a lot of criticism for the WHO about its failure to call this airborne, its backtracking at the end of March 2020, etc. But, you know, if you listen to what Dr. Tedros, Dr. Ryan, Dr. Van Kerkhove are saying, they're just saying this. It's like, you can't pretend it's over. There's no herd immunity. Natural infection, pretending that, you know, promoting infection is the work of the devil, you know, and we have to take rational disease control measures, suppression measures. And yet that's an extremist position. So we circle back to the fact that, yes, this is an information war. And the battle lines have been very clearly drawn. And there is an awful lot of, essentially it all comes down to money, behind promoting the idea that the herd needs to get back to work, and it must accept a certain degree of attrition. And that's the message. Mm. So that, as I said before, I mean, it's all pretty dispiriting, but it has to be fought against.
Have you dealt with many people with long COVID, Doctor?
No, I haven't. So I've been lucky enough. I've had a very good pandemic, actually. I mean, I've been lucky enough, A, to be in Australia. And then for the last year or so, I've been in Western Australia. So my experience of actually seeing patients with COVID is relatively recent. So I haven't seen many. And, you know, I've been just incredibly fortunate. And we were incredibly fortunate here in Australia until COVID was more or less deliberately let in. I mean, I don't think you know, I'm extremely suspicious of Gladys Berejiklian and Brad Hazard and the way in which they failed to eliminate in mid to late June last year. Mm-hmm. And it became very obvious that, to me anyway, it felt like, yes, here was the opportunity that they'd been waiting for to introduce COVID. And then they knew that once the most populous state had widespread COVID, there was no way the others could keep it out. And so it has proved.
I mean, I noticed that Vicky O'Donnell from the Kimberley Aboriginal Medical Service has spoken about the situation in West Australia, particularly amongst Aboriginal communities. Mark McGowan has declared that the pandemic has peaked, and as she has raised, it hasn't peaked, and there's absolutely no options for people in the Kimberley, particularly Aboriginal communities, to deal with COVID. Yeah. Have you had to deal with those sorts of communities with COVID?
Yes. I mean, you know, logistically and culturally, Aboriginal people tend to live together and live a much more communal lifestyle than Western people. You know, the nuclear family is a concept unknown, with child rearing shared and all kinds of relationships, close relationships of, you know, cousin sisters and such like that aren't recognized in Western cultures. So being able to isolate brings huge logistical challenges. And I think it's fair to say that none of what's happening now is, well, it is fair to say, none of what's happening now is a surprise. And that there's been a gross failure to provide suitable accommodation to help at least even slow transmission amongst Aboriginal groups.
Yeah,
it's not for one. I mean, you know, this all comes down to, I think, if you look at this in a take a 30,000-foot view of this, one of the things, or the thing that has most worried me since the beginning of all this, since Jacinda closed the New Zealand borders, and thankfully we closed them too. If she hadn't closed them, I don't think we would have. And we eliminated. I mean, we eliminated in April 2020 pretty much by accident. I don't think anybody expected we would, but we did. because, as you said, people were extremely compliant. There was a great community spirit, etc. But ever since, here and in New Zealand and in other countries as well, like Korea, etc., there has been a failure to put in place any other measures. So we've had this razor-thin defense at the border, and the failure to understand that this virus spreads through the airborne route has meant that we have failed to harden our infrastructure and change our behaviors to accommodate that. If we had recognized that early in 2020, as we could have, because it was known, and we had worked to educate people about how COVID is transmitted, if we had made available N95 masks free for the entire community, educated people how to keep well, if we had instituted ventilation improvements in indoor buildings, HEPA filtering where that was not possible, and done everything to secure our society against not just this pandemic, but potentially future pandemics, which will either come out of this pandemic or may arise de novo, then of course, we wouldn't have had to have a precipice where we opened the border and then all of a sudden there's a huge deluge of cases, because we would have sort of fortified our defenses, but we did nothing. Nothing at all. And to even get HEPA filters into hospitals and universal masking with COVID patients has been a huge struggle. So this kind of intransigence, this kind of resistance to innovation, this unwillingness to accept that the world has changed has really been catastrophic. And I think in the case of Australia and New Zealand, it has meant that we squandered a significant amount of our early advantage. It's not to say there was no advantage. We saved a lot of lives, but we squandered a lot of that advantage. So there was no, if you look at it in military terms, we had good tactics, but there was no strategy. And a lot of hope was put in the vaccines, which I did too. The hope that we would have a sterilizing vaccine, which would significantly reduce transmission, and that has not transpired. And when that did not transpire, I mean, if we'd had a sterilizing vaccine like a measles vaccine or something like that, we'd be in a much better situation. We wouldn't be having this interview now, probably, but we don't have that. And yet, when that became apparent that the vaccines would help drastically reduce serious illness, potentially reduce long COVID, but not eliminate either, but would not significantly suppress transmission. When that was realized in early 2021, there was no consequent shift in strategy. It was just like, well, we'll just press on anyway, get everybody vaccinated, and then, just people will just go on and we'll just accept the toll. So I think, if one's looking for the roots of where we are now, that is it, a lack of strategic vision, even in countries that did well.
Well, you also see that reflected in the budget. There is nothing. And really lead up to the budget, there's no plan B, there is no forward planning about what to do, no expansion in personnel, in facilities. It's an outrage.
No, there's nothing. Really, it gets up some people's noses when you talk about this pandemic in military terms, but actually it's quite a useful framing. And that, generals have to think in terms of tactics and strategy. Shorter term tactics to gain control of the situation, and then longer term strategy to maximize the advantage. And we don't do that. We're not doing that. There's no vision. every time there's a new wave, it's like, oh my golly gosh, there's a new wave, what a surprise. And then we simply are unable to encompass the fact that there'll probably be another one and that it's inevitable, and that we're actually breeding ever more resistant variants, that there is no selection pressure in that breeding for reduced virulence, and that we're rolling the dice every day that we allow unsuppressed transmission, and that we may rue that one day, because we may get something that's really transmissible and really lethal. And there's no reason why that can't happen. There's no magic law that says, you know, this is a film with a happy ending.
And quite impervious to the vaccines.
Yes, inevitable. I mean, you know, we have out of control replication of the virus in an environment of partial immunity.
Yeah.
So that selects for variants which will escape immunity, and that's what we see with Omicron already. And at the same time, there's this kind of semi-religious belief that somehow it's going to become less virulent, less severe. There is no biological rule that says that must be the case. There is actually no selection pressure on the virus to become less virulent. It infects people before symptoms and during symptoms, but it infects before symptoms. As long as that occurs, it doesn't matter if it kills the host. So, you know, we're rolling the dice. And now with the antivirals are great, but they have problems. You know, they mutate DNA, potentially human DNA, but they certainly mutate RNA, which is how they, you know, kill the virus. So that's a great thing. But we have, for instance, molnupiravir, which is an oral antiviral. It's not very effective. It's a bit effective, about 30% at reducing hospitalizations. But it's a mutagen, so it causes lethal mutations in the virus to kill it. But the person who's taking it is still shedding mutated virus for about 3 days. So it's possible, and of course in India, this stuff's available over the counter for, I think, 20 rupees a tablet. So there's going to be an awful lot of people walking around who've had subpar courses of this stuff, shedding huge amounts of virus that's mutated. So, you know, it's not just that we're not doing anything to secure our longer-term futures, it's that we're actively shooting ourselves in the foot.
Have you had a look at the material we've published on the Global Inquest, and now plan to take forward a program of education and mobilization?
I haven't actually. It sounds great. I'm sold.
That's good.
Right.
Yeah, that sounds good.
Yeah, no, we've been interviewing many scientists, also health workers. You know, as you say, this is it's a war, but we have to begin a mobilization from below in alliance with scientists, doctors, etc. It's a political struggle here.
It is a political struggle. It's nothing to do with science. It's a political struggle, and it's an information war. It's about, you know, combating misinformation and slants, which on the one hand, which minimize the problem. I mean, you can't mobilize and fight a war if most of the population doesn't believe there's a problem.
That's true, but as we were discussing before, the population, when they're given a lead, when they're given, they respond, and you
totally.
You saw this over the Christmas period. The politicians were declaring Omicron's mild and blah, blah, go out and shop, and they didn't.
Yeah. Oh, yeah. And I have to say, you know, Australians are really civic minded. You know, they do think about the community, and much more, I think, than in Britain. And so, you know, I mean, Aussies love to do stuff for each other, and they love that, you know, the Bunnings sausage sizzle and, you know, cake bakes for the RFDS and all that stuff. And people love it. And so this notion that we've suddenly been indoctrinated to be these selfish people, not caring for those around us, not caring for people who are vulnerable, it shows the power of propaganda.
Yeah, if you remember, just before Christmas, when Omicron emerged, the chief medical officer, Paul Kelly, I think his name is, declared that Omicron
Christmas
was
present.
Yeah, his best Christmas present.
I know. On the basis of zero
evidence,
good information.
Yeah.
So the GP who treated the president, she's the president, I think, of the South African Medical Association, Angelique Coetzee, and she basically, Omicron arose, and like within 3 or 4 days, she was saying, oh, well, all the patients I've seen with it are really mild. And then that was it. It was like mild took off. It was a meme. Omicron is mild. And that meme just went, you know, totally crazy. It was the Gangnam style of late 2021, early 2022.
Yeah.
It was just a craze.
Yeah.
But, you know, people were desperate for it, and the politicians milked it for their own ends.
Yeah.
But there wasn't any meaningful truth to it. You know, it's milder because we're all vaccinated, but it's much more transmissible.
Yeah.
And if you look at the global death curve,
yeah,
if you look at the two curves, there are basically two curves, I think, that are the most important, the only ones you really need to look at, because this is one world. Global new cases, global daily new cases, and global daily deaths.
Yeah.
And if you look at the Omicron global daily new cases, it's huge, it's massive, way higher than Delta.
Yeah.
So it's way more transmissible. But if you look at global daily new deaths, that's also higher than Delta. It's only a bit higher than Delta, but it's higher than Delta. And so, you know, a small percentage of a massive number is still a very large number.
Yeah.
So this is basic maths, which, you know, you can fool people into not believing with propaganda, unfortunately, and that's where we are.
One of the purposes of the Global Inquest is to hold particular individuals accountable. I mean, there are, you know, we what did the British Journal of Medicine talked about the responses of governments around the world as social murder.
Yes.
Well,
Cameron Abbasi, the editor. Yeah, it is social murder.
That's dead right. And individuals, people have to be held accountable for what they said and did.
Yes.
And we need to.
It's like, you know, you can say to people, well, it's all personal responsibility. You've got to protect yourself. Yeah, right. If you're a minimum wage shelf packer or you're a bus driver and you've got a family to feed and hardly any sick pay, you know, you don't have the option to isolate in your second home and work via the internet, do you? And once you get into that kind of inequity in terms of disease, then yes, of course, it's social murder.
Yeah,
that's right.
Yeah, no, I think that's absolutely fantastic. I have to say, I think you guys have done a great job with your coverage. I think you're really one of the best media outlets there that has done a good journalistic job and that has actually delved into the ins and outs and has not simply regurgitated press releases. So well done.
All right. Well done for you for participating. Thank you.
That's okay. Thank you very much. Real pleasure.
Thanks,
okay.
Dr. Berger.